Indiana and its public health officials are entering a new stage in the fight against COVID-19. But in the state's least vaccinated county, it's an uphill climb. Brock Turner brings us the first of two reports on what the state is doing to get shots in arms.
In LaGrange County, Indiana, 1 in 5 residents are fully vaccinated against COVID-19. For health officials, the hopes of herd immunity via a vaccine is just that.
I think getting herd immunity through vaccine is a fool's errand in our county.
Dr. Thomas Peachin is the county's health officer and has practiced medicine here for 30 years. Many of the challenges he faces are present throughout the state.
We have plenty of access to vaccine. We have plenty of education. There's been plenty of information shared with people. And basically, people are making their own decisions. And that's the way America should work. So, and we have a great hospital system that can take care of people when they're sick. So, we're in the position of, hey, you know, here's the information, take it or leave it. But don't get your information on healthcare from the local steel cutter, okay? Get it from somebody who knows what the heck they're talking about.
One of the other local health authorities is the owner of Topeka Pharmacy, Trevor Thane.
I bought the store in 2018, and then my wife and I got married, and she's a pharmacist as well, and so she and I have been working here and running it now for 3.5 years.
Thane played an integral part in a state program which funneled COVID vaccines to pharmacies shortly after they were available. He believes it was successful, but demand has dried up.
In the last month or so, I've seen a pretty sharp decline in the demand for the shots. Instead of doing, 60 or 70 a day and ordering 300 or 400 doses a week, we're getting maybe 100 doses a week and just, 10 appointments, here or there on a day and taking walk-ins now.
Thane even says he's made house calls and stayed after hours to help those who might have scheduling or other conflicts. But you wouldn't know it when looking at the data. In multiple LaGrange County zip codes, fewer than 15% of residents are fully vaccinated. A large Amish population resides here. Local health officials say they've struggled vaccinating and combating factually questionable information in the community. A group that serves as liaisons between the Amish and healthcare providers declined to comment for this story. But the low vaccination rate can't be blamed exclusively on any single group. Last month, CDC officials toured the county, but local leaders say federal health authorities didn't offer any real solutions.
I don't think there's a universal, magic bullet that'll fix everything. I think there's so many things intertwined into this thing, whether it's politics, religion, culture. I mean, all that somehow got mixed into just something that's just black and white science. It's really tough.
Indiana ranks in the bottom half of doses administered by state per 100,000 residents.
So obviously we're disappointed. We would rather be higher with our percentage of fully vaccinated individuals.
Last week, the state's top health officials admitted the vaccination efforts have hit a wall.
We knew there would come a time when we would go from people, very, very anxious to get the vaccine and are not having enough, to a time when we were really working very hard to get that next individual to be vaccinated.
For healthcare workers in LaGrange County, that's a daily fight.
I've got more bags under my eyes and gray hair, and actually just less hair than when I started this back at, before March last year.
Thane and Peachin both worry about a variant, like Delta, that is more transmissible spreading here among the unvaccinated. A surge in cases could quickly overwhelm the local hospital. But both insist they're invested, and in spite of the struggles, will continue to work for what they know is in the best interest of residents.
Because if we don't do it, nobody will. And that's, we have a handful of people in the community that are very like-minded with me on that.
It's my community. These are people I know, and very good people. They just have misinformation, and my challenge is try to correct that, and it's been a real uphill climb. It's just and it's not over yet.
For Indiana News Desk, I'm Brock Turner.
Next week, we'll look at how one county is taking an innovative approach in trying to get its residents vaccinated.